I have my appropriate PPE precautions on. I'm observing the environment. The scene looks safe. Is the scene safe, examiner? Yes, the scene is safe. My general impression is an approximately 14-year-old girl, Asian patient sitting in a moderate level of distress. I will now determine responsiveness using the AVPU scale. Hello, my name is Joseph. I'm an EMT. Can you hear me? The patient is awake and alert. I identify no immediate environmental, social, or physical life threats. Since the patient is conscious, I will determine their orientation. Can you tell me your name?
Ellen.
Do you know where you are right now?
Yes.
Do you know what day of the week it is?
Saturday.
Can you tell me what happened?
I have a terrible squeezing pain in my chest and I'm having trouble breathing.
The patient is alert and oriented times 4. What is your chief complaint today? What made you call the ambulance?
There's a squeezing pain in my chest.
Okay.
And I'm having trouble breathing.
Placing an oximeter on top of the patient's finger. The patient is talking smoothly to me, so they have a patent airway. I'm assessing breathing. I know equal chest expansion and adequate depth, but the rate appears rapid. I'm checking the SpO2 reading. Examiner, what is the patient's SpO2 reading? The SpO2 is 92%. Because the patient is experiencing respiratory distress and SpO2 below 94%, I will initiate appropriate oxygen therapy. I'm placing the patient on 15 liters per minute of oxygen via a non-rebreather mask, titrating to keep their SpO2 above 94%. Going to check radial pulse. The radial pulse feels strong and regular, about 90 beats per minute. I'm assessing for any gross major bleeding and I see none. I'm assessing the skin. It is pale, cool, and clammy. Because of these signs, I will initiate shock management by keeping the patient warm with a blanket, ensuring high flow oxygen, and keeping them resting comfortably. I will not identify patient priority. This is a high priority patient. I will make an immediate transport decision and request ALS backup to meet us en route. Because the patient is fully oriented, I will conduct a focused secondary assessment. Let's figure out what's going on. What were you doing when this chest pain first started?
I was just sitting on my couch watching TV.
Does anything make the pain better or worse, like changing positions or taking a deep breath?
No, nothing at all.
Can you describe the pain? Is it sharp, dull, squeezing, or burning?
It feels like a heavy elephant is sitting right on top of my chest.
Does the pain move anywhere else, like your neck, arm, or shoulder, or jaw?
Yes, it's radiating down my left arm.
On a scale of 1 to 10, 10 being the worst pain you've ever felt in your life, how would you rate it right now?
It's an 8 out of 10.
Exactly how long ago did this pain start?
About 25 minutes ago.
I will now ask 2 clarifying questions. First, are you experiencing any nausea, vomiting, dizziness with this pain?
Yeah. I have I'm feeling a bit nauseous.
Second, do you feel a cold sweat or sudden extreme fatigue?
Yes, and I'm very sweaty.
Okay, thank you. Now I need to take your medical history. Aside from the chest pain and nausea, do you have any other symptoms?
Just the shortness of breath.
Are you allergic to any medications, foods, or environmental factors?
No allergies.
Do you take any regular prescriptions, over-the-counter medications, or herbal remedies? Specifically, do you take nitroglycerin, or any erectile dysfunction medications in the last 24 to 48 hours.
I take blood pressure pill and I have a prescription for nitroglycerin, but I haven't taken any today. And no ED meds.
Have you ever had pain like this before, or do you have a history of heart problems or high blood pressure?
Yes, I have a history of high blood pressure and angina.
What was the last thing you had to eat or drink, and when was it?
I had a sandwich about 2 hours ago.
Leading up to this, did anything unusual happen, or were you experiencing any stress before the pain started?
No, I was completely relaxed.
I see. I'm using a stethoscope to listen to the lung sounds in front. Because my patient is a CAO times 4 with a cardiac and respiratory chief complaint, I am performing a focused physical assessment of the affected body systems. I'm inspecting and palpating the chest to rule out any trauma. The sternum is stable and I note equal chest expansion. I'm inspecting the neck. There is no jugular vein distension and no tracheal deviation. I'm now osculating lung sounds bilaterally, which I already did, and lungs are clear and equal in all fields. I also inspect the lower extremities, and there is no paddle edema or signs of deep vein thrombosis. Now I'm going to wrap the blood pressure cuff around the patient's arm and pump it up. So here. I'm now gathering full baseline vital signs. I will count the pulse for 30 seconds and multiply by 2. I will do the same for respirations. I'm taking a manual blood pressure reading. Examiner, what are my baseline vitals? Blood pressure is 140/90. Pulse is 92 strong and regular. Respirations are 20 and slightly labored. I'm checking the pupils with my pen light. Pupils are equal, round, and reacted to light. Based on my assessment, my field diagnosis is acute coronary syndrome or suspected myocardial infarction. My interventions will include administering 324 milligrams of chewable aspirin per medical control protocols and assisting the patient with 1 dose of their prescribed nitroglycerin, provided their systolic blood pressure remains over 100. Because this patient is high priority and unstable, I'll demonstrate how and when to reassess. I'll reassess this patient every 5 minutes en route to the hospital during each reassessment. I will check their vital signs, evaluate how interventions like the oxygen and medications monitor their chief complaint, check their ABCs, and confirm their mental status. We have now arrived at the emergency department, and I am given my verbal report to the receiving nurse. This is a 14-year-old woman, patient who called us for severe squeezing central chest pain, radiating to the left arm, paired with shortness of breath. The patient is a CAO times 4. Onset was 25 minutes ago while at rest. Vital signs showed a BP of 140/90 and pulse 92 and respirations 20. We initiated 15 liters per minute of oxygen via a non-rebreather mask, bringing their SpO2 and managed for shock. We administered 324 milligrams of aspirin, and the patient has a history of high blood pressure and angina. They are ready for transfer to your care. And now I'm finished my skill assessment.